It's not written on my face that I am Professor Farooq Afzal, right? I can be brought into any emergency, right? And the people who are basically treating me are you people. So if you have to go to a doctor, which doctor you would like to go? The best one. So I want every one of you to be the best doctor, right? Because if you don't aim higher, you're not going to reach anywhere, right? So be the best doctor to whom you want to go. And for that, you have to have proper training, right? I'm not against anybody. I'm just for the idea that we all deserve better surgical education, because I am into the surgical education. So we all deserve better. Now, very important to know that the talk which I'm going to give you is technology enhanced. It's just not a new idea, right? There are many professions that are using this before us, right? Look at these pilots. They'll already be using this technology before somebody handles them aeroplane with passengers on. And we are managing the most important thing the God has created, the human beings. And why should we compromise on the training and the exposure of our doctors? Because we have to deal with the most precious thing, which is the human life. And that's the reason we have to. Now, before I talk, there's a very important message, because artificial intelligence is the buzzword these days. Machines are everywhere, smartphones are everywhere. And for me, I was just recently, I was in Peshawar last night. I just came early morning, 5 a.m., right? And I'm just not, even if I'm driving. So I met a guy, Dr. Khalid Godat. His brother is one of the Google vice president, right? And he just wrote a book, Scary Smart. Yeah, those of you who are sitting in the back, right? For me, it's not important that you get good knowledge. As Einstein said, imagination is better than knowledge, because every day we are having new problems. So one of the scary things about artificial intelligence is that I fear, and it's shared by many of us, that it's going to kill the creativity of the doctors, of the human beings, number one. The second thing is, it's going to take away the compassion, the care, because all the time you are dealing with the patients, with the machines, and you are forgetting the most important person, which is the patient. So mind you, please, our values, as Dr. Amir Sa was telling you, our values are much more important than our knowledge and skills, because our knowledge and skills change, our values stand same. The respect for elders, right? On a dining table, one day my son said, "Why are you waiting for Dada Abu?" Right? "I'm hungry, I want to eat." I said, "No, you have to remember this is our value. So please remember this. Do not be involved in this when the patients are there or when their family members are there. We are losing that connection. There's a great book, Connect. So we're losing that connection. We are more into these phones rather than talking to each other. So please, this is just a preamble. I like this guy. He has got a lot of books. So please read that. He is one of the surgical philosophers. I think we need you. In the journey of surgical education, technology is the compass guiding us to new frontiers. We have fourth industrial revolution going on, from started with coal, the gas, then the electronics, and now we are into internet. And I think this artificial intelligence may be the fifth. We don't know. This may be the fifth. I don't know, but this is going to change us. Okay, so I'm going to talk about three things: integration of technology. That's very important. And why we need to integrate. What is the evidence of that? And once you are integrating, we need to change our curriculum to adapt to that technology change. And these are the questions. Now, there's a word called paradigm shift. Thomas Kuhn was an MIT guy. In 1962, there were two great books written. I rate them as one of the best books I've read. The first one is Diffusion of Innovation by Everett Rogers, and this by Thomas Kuhn, The Structure of Scientific Revolution. Now we have paradigm shifts, right? Science has not progressed linearly. There are always paradigm shifts. What I see right now is a great paradigm shift because we are more into technology to enhance. And how does this happen? There was a sudden phenomena, which is the epidemic of COVID. Now, during COVID, we realized that we have a lot of armamentarium here available with us, but why are we not utilizing it? The basic scientist is very dependent on his lab. He goes there, he works there, and initially in our days, there were a lot of animal labs, but now we see that people are not going into animal labs. There are less animal labs, there are more animal rights activists. Secondly, you don't find any cadavers, right? But that's also, do you have a cadaver in your lab, in your anatomy? So you are very lucky because most of the colleges don't have cadavers, right? So where are you going to get the training, right? This technology has basically opened up, right, a new era. I operate maybe parathyroid adenoma 3 months, right? Every time when I operate, I go and see and watch few expert video which I have, or I go to the internet, I see the critical steps, go back. So repeated observation, imitation, practice, this is going to give you enhanced skills and competence level. So this is very important that we should be. These are the current problems. लोग मुझे समझते हैं मैं कोई बहुत बड़ा politician. No, absolutely, I'm not a politician. I am for this. This is the reason I basically advocate that our surgical education, because the person, the person or the thing which is being affected is human life. And we cannot produce a doctor of low quality to handle us, right? We have to have the best. And one of the main reasons is there is a reduced operative exposure. Now, I was professor of surgery a few months back, so 40, 50 persons, maybe more than that. In LGT it was 60. So how can this small cake, agar aapki list has 6-7 cases, how can you give 6-7 cases to 60 people? You can't train them, right? So there is a reduced operative exposure, and that's the reason people just pass exams and they have only knowledge maybe, and then they don't have the competence. And knowledge, you know, has a very short half-life. All right, so we are talking about change. The practice of medicine is change. In my time period, in 1993, I have to basically go for this dissertation, and I have to pay 700 rupees, right, for just this PubMed abstracts, and my pay was maybe 2,500, right? So look at the amount of thing which has changed. So this digital revolution basically has, and this digitalized revolution is coming to all fields, not only the medicine. The other profession has taken up long before us. The second thing is preferences, practices, and practicalities. You know, preferences. People, my kid was using U-word for steps, and he said, "Baba, for the last 5 years I've studied MBBS. This is the best book. It's not a book, but it teaches me like a teacher. It teaches me like a classical book. So I use this, right? And I have learned the maximum out of this book." So preferences has changed, right? Practices. Now we ask people, go, prepare your lectures, prepare your presentation, team-based learning, come here, we'll only discuss the practical applications, and right? Who are going to buy this? I went to this book exhibition, and मेरे लफ जो कि हमारे ज़माने में बड़ी सस्ती सी किताब थी गरीबों की, so that I bought it in I think 18,000. So how many of you can buy that? I mean, you are coming from that. So if you have to buy Balen of 18,000, there are other books which you have to buy. So everybody has now a pirated copy of Balen Love, right? So this is the revolution. And there's a revolution not only in medical information, there's a revolution in surgery. And it's happened in front of me, where we just saw open surgery, and there are great masters. One of the masters is present in this hospital. I've learned a lot, Professor Azim, right? Then laparoscopy came in. Our teachers were very scary whether to adopt laparoscopy or not. They had debate about it, right? Again, there are few who were privileged and there are few who were not privileged. And now we have robotics. And again, the same story is getting repeated, right? Same story is getting repeated. We're talking, पहले laparoscopy खत्म नहीं हो रही थी, अब कह रहे हैं कि यार robotics का experience. So if you want to teach somebody robotics, would you like to pick me, who is almost reaching 60, or you like to pick maybe Talat or Shahid, who are at least have 25, 30 years to. So our priorities has to change, right? We have to develop people who will carry on this torch forward. Okay, so solution of all this is technology, right? So I'm going to talk about something in technology. This is the digital literacy you already talked. Is anyone of you not familiar with any of the thing mentioned over the slide? So I'm a member of this CSATs community. This is from Ethicon, right? Every week they send an email of somebody who has done a procedure and they ask me to give a feedback. So while I give a feedback, I learn also. And I also see the way he is doing it. So if that is different from me, I learn from it. I correct myself, right? Similarly, lot of videos, good accredited videos, not go for everyone. There are many Indians who are doing it wrong way. So there are very good videos available, web search. So the online sources are tremendous. You have to pick which is the most reliable and validated one. And you can learn a lot. I had this access through, not my CPSB, through my Royal College, right? I can access the databases of journals, right? And I can read any article. Right? I can deliver any article. But that 700 still pain in my heart, because I think maybe at that time this internet would have been there. How many of us using this Zoom? We just use this Zoom technology right now for the benefit of us. How many of us learn from that? And this is possible in the COVID era. So COVID era, so आपको जैसे ना वो कहते कुबे नु पे ही ते सीधा हो गया. So this is basically what has done. This COVID has done to us, that it has opened up the new horizon, a paradigm shift. Now we are realizing on this. So there are many things which you learn. Google, every time you are using the Google, right? I use this as a tutor as well. So there are many groups. We are all learning, surgical oncology group, this group and that group. So we have a lot of digital information literacy and everyone. So I met few teachers, they said, oh yaar, mainu nahi aande, adara karke dikha. This is no more an excuse now, right? This is no more an excuse that you do not know the digital. You have to be literate. Japanese says, if you are literate, only if you know how to operate these digitals, right? That's not knowing ABC or 1, 2, 3. Now we've been using this simulation in a very primitive way by doing these box trainers and other stuff like that. But they had a less context to real setting, right? Well, I believe these cadavers are the best one. If I have to operate on somebody, this probably before that, I need to have a cadaver course. This is no, but this is not available. The alternative in UK is a Thiel cadavers. And what is a Thiel cadaver? Michelle Hussain को जानते हैं आप? Michelle Hussain, BBC की वो है. So I was so much surprised to see that the father of Michelle Hussain, a famous, she's from Bangladesh, a famous BBC reporter, newscaster, his father donated his body that after my death, it should be utilized by medical students or people for training, right? So Thiel cadavers, they just put some, after you are dead, they put some solutions to keep your body just as it is alive body. It doesn't bleed, but it is as fresh as human body. And people utilize for flaps and other things and stuff like that. So it's a huge change. But what I'm going to talk about a little bit is the high fidelity. We know this is not very much possible. Hands-ons are not possible on human beings, the safety issues, patient safety issues. But this is the one which has tremendously changed the horizon in technology training, right? Or surgical training. We'll talk about what is this immersive technology. So immersive technology, Dr. Khalid also mentioned about it. This is either in the form of virtual reality or augmented reality or a mixed reality. How many of you are aware of metaverse? So there is a universe and there is a metaverse. Now, most of the kids are living in metaverse because they have their virtual reality simulators, right? So they're all the time immersed in it. So we have this lab sim or sim. I'll go show you some video, and this augmented reality, Google Lens and CT guided surgery, right? We'll give you some example of this. And if you see, most of the universities like Stanford and Harvard, they started using this Microsoft HoloLens to teach anatomy. And this has changed the whole concept. I wish I knew anatomy through HoloLens when I was my students. So how can we basically integrate into it? This is a document published by ASIT Committee on Technology Enhanced Training. And I just want to share with you, I think most of you are medical students, just see what is the need. If your need is decrease the protein exposure, these are the solutions: simulation, immersive technologies, surgical videos, or live streaming, right? And Proximi is one platform which was used in COVID to see the live streaming. So we can use telemedicine and live streaming to enhance our approaches. See the experts operating, how they are operating, and watch, and you can do the same operation later on. We are using this video analytics. I had a talk, Talat asked me to talk about the predictive analytics. We're using this video analytics, and I think Khalisa also mentioned, they're teaching you, the machine is teaching you what were your shortcomings, and every exposure they are recording, especially in the robotic platform, they have incorporated this machine intelligence. So every time, so we've done 10 or 20 or 30, they will tell you your progress. And this is the way you learn that where I'm going, and achievement is asking a big motivation. So once you achieve that somebody is appreciating me and I have achieved the safety, it gives you a big motivation too. Can we run this video? I just give you maybe आपको मेरे से ज़्यादा शायद videos देख रहे हैं, but just see. When I was interviewing for medical school, I learned that case sir was introducing a new progressive program using the Microsoft HoloLens to teach anatomy. It definitely factored into my decision making. We developed the digital representation of both the male body using easy details that a medical student needs to know. I didn't think that any sort of technology could come close to what we're doing now. It was pretty incredible. The way I've been describing it to people who haven't worn the lens yet is kind of like in Star Wars when the webs like pops up a little bit. Now you see your body is just standing right next to you. You could hear people like in awe and then just saying, this is so cool. And all it allows you to do is see structures that would be really difficult to see. Right, okay, so that's it. So I tell you one thing, if I have known surgery, it is through my anatomy, right? The better mental picture of the anatomy makes you a better surgeon, right? So these virtual, basically, solutions, HoloLens, they basically give you. You can go in, you can zoom out, right? You can see the details and everything, right? So this is a huge revolution in teaching. This is VR. I think you have a in Shalimar. I think with Talat in chair, I think you are going to get it soon. So this is just like a real. If you do 10 times, right, the 15 times. So I am going to propose to the college as well and to other universities that we should have these simulators, and it should be part of our log, right? That we have performed about 15 or 20 on the simulator before we are called for an actual patient. It will enhance you. अगर आपने सूचनी और टाइम देखी हो, I was senior registrar. We used to have a lot of vascular trauma, and I didn't know how to improve. So I went to Lohari, और वहाँ से वो बलून होते हैं ना पतले वाले, right? तो वो सारे को मेरा 3-4 दर्जन में लेके आया, और धागे से उनको हर वक्त end to end anastomosis, कभी end to side anastomosis, and it was a very cheap solution. अपना वो मेरा तकिया था, soft तकिया, उसको काटा, उसी को stitch. And this is big. So you can all do that. You have to have a very simple solution. You don't need that all the time high fidelity. There is a solution to it as well. इसको skip कर देते हैं, आगे चलते हैं. Okay. So now in the era of robotics, and there are two companies. I think laparoscopy came, and laparoscopy had no simulators to start with. So people struggled. Lots of lives were lost. Same is not the case with the robotics. Robotic people learned from that mistakes of laparoscopy, and they came up with these simulators. And in many countries now, if you are going to want to operate on a robotics, before that you have to basically complete the sessions on these simulators. Just like the pilots doing, they have to have certain training on the simulators before they are being brought to the patient. तो एक किसी एक को क्लिक कर दें, ये जो वर्चुअल CMR का है और ये they are the same one.
The only all-inclusive Da Vinci simulation and learning program. SimNow provides you the true Da Vinci experience. Let's explore the program. SimNow consists of skills, procedures, and planning. Skills. The skills section is a constantly expanding library of simulation exercises, all optimized for surgeons at any learning level. Over 30 of the latest comprehensive core learning exercises are available, including instrument playground, FRS, and the combination exercises. First, our instrument playground enables you to virtually experience up to 12 different instruments. You can deploy and exchange any instruments you like. Second, our FRS, or Fundamentals of Robotic Surgery section, offers you a preset learning curriculum designed for your specific surgeon skill set. Skills training, skills maintenance, and skills credentialing, for example, are all available. And finally, our combination exercises. They offer advanced simulation modules, providing you an opportunity to integrate and practice your skills in a challenging environment. All of these sections can provide you with a
So not only you know the new tricks, but you maintain your skills. So this is a great way, and this is, I think, what we have learned from the laparoscopy experience, and this has made us smarter, right? This is for all who are basically senior enough to understand the importance of video analytics, right? You basically are operating your robot. If you are operating robots, he's telling you where are you spending more time and why are you doing this. So it is going to make you more efficient and give you more reflection when you watch this, right? This app by Medtronic, I want all of you to have it. It is a very, इसको दूसरी वाली वीडियो को लगाइएगा. दूसरी वाली वीडियो जो वो वाले टच सर्जरी वाली, yeah. This is free app. All the surgical residents, please use this. So if I want to go to gastric bypass, operate gastric bypass, and you are going to go assist it, you watch a gastric bypass over here, and you will all the concept, what is a gastric bypass and how I'm going to assist it, what are the steps. Okay, next study. All right, so these are not very costly gadgets. This app is available. You can just download it. Next slide. Okay, so we don't need to take it. This is what's a word of mouth. There's a lot of evidence, right? I don't have to tell you what the amount of evidence. Just few of the important papers I put. There's a lot of evidence that simulation improves your surgical exposure, training, maintenance, and everything. So mind you, utilize this. This talk, if you have just gone there, whatever as a surgeon, whether you are a medical student or a big surgeon, simulation has a role. I remember Atul Gawande's one of the talks is that after doing 2,000 thyroidectomies, he thought I should have a coach in my theater. 2,000. यहाँ पे तो आप 50 करने के बाद अपने आप को बहुत बड़े एक्सपर्ट समझना शुरू हो जाता है, right? 2,000 बंदे ने thyroidectomy है, and he was surprised when the coach went in, right? He gave him a lot of feedback, and he thought he was a superstar. He was ignoring. So there are many blind spots in your reflection which you are not watching, right? And by getting a feedback from a coach, that blind spots are being covered, and you become better at what you do. Obviously, it shortens the learning curve. We have a lot of evidence for that. And this is the first time I came to Pakistan. We started this in services. Sadaf is basically a witness to that. And this has revolutionized because these are validated, although these are from Gerald Fried, from McGill. And now what I've seen is that if you do this, there is a concept called transfer of training. Khalid and Talib knows it better. That you can apply, if you are doing laparoscopic cholecystectomy, the same skill will help you to perform a lap appendix, right? It makes you bit. Similarly, now we say that if you are doing laparoscopic surgeries, you go to robotics quickly because there is a image learning and everything there. So after do that, I'm going to advocate, because at least one other person is sitting here and many others are also sitting here. They are future leaders. They are leaders right now, but they are future leaders. We need to sit together and plan a change. These are generations who are high tech, Generation Z, right? So they are all the time on their phone. We need to devise strategies as per learners, right? So that's why I, as a trainer, need to know what is digital literacy, what is technology, how that technology is utilized. If only I know, then otherwise, what will happen? These guys are going to operate. I just heard a very painful story of this happening. आजकल हम वीडियो देख के फौरी तौर पे ऑपरेट करते हैं. So the Bao Gaudat ने किताब लिखी, right, was a solve for happiness. And why? Because his son, 21 years, so he's a Google vice president working in Dubai. His son developed acute appendicitis. He's brought to a Saudi German hospital in Dubai, right, for an appendectomy, which was done laparoscopically. There was a surgical resident who has never done a lap appendix. He tried to do that, and the first port he basically put in, it went into the aorta. And before they could recognize what has happened to the patient did not make it. So this is the importance of basically having. And out of that, he went into, he's a big man. He went into the crisis, losing your son at this age. So there are many graveyards of every surgeon, right? So we are not in an era. Now we are in an era where we are questionable. Society asks you questions. 1 minute में वीडियो वायरल हो जाती है वो सारा कुछ. So we have to be accountable to ourselves, right? This is very important. So I think these are the things surgical educators need to know. But mind you, whatever you do, don't forget that whatever you're doing, basically, the center of universe of yours is patient, right? Do not compromise the interest of the patient. These are machines there to improve your health, but do not do it at the expense of the patient. And do not forget to be compassionate. If somebody says, and somebody asks, a medical student asked me this question, sir, if you have a choice between compassionate and competent, which will you pick? And that was a very difficult question. But at the end I said, well, I would like to be compassionate first, because the second thing comes afterwards, right? If I am not compassionate, even if competent enough, I do surgeries out of overconfidence and might kill people, right? Because I think I'm the superstar, right? So compassion is very, very important. And these are the few recommendations. I think I'm getting late, so I will skip all these. Just remember this quote. Anybody can read this for me, please? But read this. That's very important. I want you to remember this.
It's not the strongest of the species that survives, but the most intelligent. It is the one most responsive to change.
So, ladies and gentlemen, dear students, teachers, always ready for a change, because you cannot survive without a change. Thank you so much.